let's go ahead and get started. I'm going to keep promoting people as they join, or Joe can. I'm really pleased to introduce Mark Omo today from Marcus Engineering in Tucson, Arizona. Um, and Mark is going to be telling us about post-quantum cybersecurity and what it means for you and your medical devices. And what's really interesting to me is that in we're talking about anything, any connected device, any hardware, anything that has any connection to the internet whatsoever or can be connected to the internet. And so the implications for hospitals and hospital networks as that have devices that might be insecure. So anyway, I'm not going to talk anymore because that's what Mark's going to do.
Hey, good morning. It's great to meet everybody. So, like John said, we're going to talk about post-quantum encryption. So, one of the things is if you're planning a device now or you have a device on the market, it's going to expire. You're going to have components in it that are not going to be allowed in the future. I hope everybody wants to know when that's going to happen. So a little bit about Marcus Engineering. So we do medical device design and development. We make stuff that you can touch. We make real devices. We don't make SAMD. We don't make things that float around in the cloud. We deal with product security, which is what we call security of physical devices, physical things you can hold. And so most cybersecurity that you see today, most cybersecurity people do is protecting clouds, protecting websites, networks, that kind of stuff. And that's not where we specialize. We specialize in stuff that you can touch. So I was talking a little bit about cryptography. So it's how we secure sensitive information, protect it, like PII, medical devices, data that flows around, everything, almost everything that you touch today is protected by cryptography. And so its security is really fundamentally based on these kinds of problems that experts consider very hard. That's how we build cryptography. And so quantum computers can solve some of these problems a lot faster than traditional computers. And some of these problems include these hard problems that we rely on for security. It makes them not nearly as hard as they were in the past. And so that means that some of this current cryptography creates a need for what we call post-quantum cryptography, which is hard problems that are not made significantly easier by quantum computers. So you guys may or may not know that in November, just a few months ago, NIST, the National Institute for Standards and Technology, released its first guide about what post-quantum cryptography is required and the timeline for its rollout. So how long do we have before you have to transition to it, and what are the recommended replacements for it? And so I'm sure all you guys are familiar with the FDA cyber guidance. It tells you that you shall follow NIST's recommendations. They're not just recommendations from the FDA perspectives; they're requirements. And so it requires you to use cryptography that is strong today and that will be strong through the lifetime of the device. And so their guidance is going to deprecate cryptography that's not quantum resistant in 2030. And you can see here the FDA specifically calls this out, that you shall not or should not implement cryptographic algorithms that have been deprecated or disallowed by NIST or any of the other controlling organizations. So there's only 5 years until a large swath of current cryptography is going to become deprecated and disallowed for use in devices, services, all kinds of stuff. And so I have a question for everybody. What do you guys think the average age of an on-market medical device is? I ran a report to see for devices actively on the market who fall into any of the categories That means that they have electronics and software inside. They fall under the FDA guidance.
20
Um,
years.
20 years.
Other
Anybody else?
guesses?
Uh, our manual says it's 7 years, and I think it's at least 15 or 20.
Oh yeah, I posed this to some other people, and they were like 3 or 5 or something. They're quite optimistic, I think, about the age of stuff. So it turns out that I read a report, the mean age is 14.8 years, and the median age is 12 years of on-market devices. Um, so there's only 5 years until this mandate starts, and so that means that if you have a device that launched yesterday, it's going to intercept these requirements. And obviously, if you're designing stuff today, it's going to intercept these requirements. And even devices that have been on the market for 5 years are going to are likely to intercept these requirements.
But Mark, are those connected devices or all electronic devices?
So this is the average age of all electronic devices. You see one all the way at 40 years. That's an endoscope with a filament lamp that's still sold today. So you're right. It's a little different for devices with software that are running software. However, in my experience developing devices, basically every new device is falling under the FDA's cyber guidance. It's pretty broad, and most people today are developing stuff with software, stuff that would have been developed without software many, many years ago. So I think the set of devices that are 30 or 40 years old that are going to need this is smaller because it's not really running software. But in my experience, basically everything people are developing today is going to need this stuff, and people developed it for the last couple of years is definitely falling under that. I wish I had better data about devices that fall under the cybersecurity regulations, but that's a little bit trickier to tease out. So one of the things about post-quantum cryptography is it's way harder to implement. So it takes 10 times the space and 100 times the processing power of traditional cryptography. And so this makes retrofitting it a challenging endeavor. And so, if you're planning a new device, and these new devices are almost certainly going to need to support post-quantum cryptography. You need to be supporting today for the storage space and the processing power that's going to be required. And also, even if you have it today, lots of people have ecosystems of devices. They have a cloud that supports their device and their next device and their next device. We work with lots of customers who create these connected OR ecosystems. People who have this network effect that they're creating, or devices that they interoperate with. Lots of like connected hospital, patient, inpatient collection, outpatient collection, all that kind of stuff. And not only will all those devices, but that whole ecosystem, all the collection infrastructure, all that stuff is going to need to accommodate this post-quantum cryptography as well. And that's one of the reasons why it's so important to start now, because it's quite a complicated endeavor that really pushes the requirements of your device. And for existing devices, lots of people, I'm talking to people asking about, can you add it to existing devices? And this heavily depends. And really it comes down to two questions. Do you already have processing power? And do you already have the memory space to run these algorithms? Some systems that are really just running a full computer, those generally have enough extra processing space, power, memory to accommodate upgrades. It's more of a software patching rollout plan activity. Slower devices, it might fit into somewhere in between. But the smallest devices, like IoT devices, little connected things, microcontrollers, that kind of stuff, we've often found that those can be too small to accommodate it, or they can only be accommodated with some really significant engineering work, trying to shove 10 liters into a 5-liter bucket full of device functions and cryptography and encryption and all that kind of stuff. And there's some set of devices that really can't be upgraded and that are going to start becoming obsolete because of these encryption requirements by 2030. And so we talk about next steps. So really the main thing is, looking at your existing cryptography and the new cryptography in your devices. And so we created a tool. There's a whole bunch of overlapping NIST guidance for what in cryptography is allowed today, what's deprecated, what are the timelines, and then also what are all the transition plans for different types of cryptography in the future. So we put that all together into a tool that lets you go and select your cryptography, and it can tell you a little bit about what is and isn't allowed, and what are the timelines, what are the restrictions, what are the recommended migrations, that kind of stuff.
Mark, would you click through and put the link in the chat?
Yeah. Here, I can open it up and show you guys, but I'll drop in the chat as well.
You're wearing the same shirt?
He loves that shirt. He does. It's his favorite shirt.
Let's see.
Or he took the picture this morning.
So one of my favorite things to ask is people is, do you have your cryptographic bill of materials, so we can go evaluate what's your exposure and compliance with the cybersecurity cryptography requirements. And most people look at me as this deer in headlights look, the same kind of look I got from everybody a couple of years ago about your software bill of materials.
Has anybody heard of the cryptography bill of materials? Anyone?
I would suggest anyone who's not a hardcore engineer, don't click on that link. It will dispirit you about how ignorant you are. Just trying to help out. Oh,
and this definitely generally falls under engineering activity. People that, and that's one of the things where understanding which button to click requires understanding what's all included in your device and what's all the parts. And just like your software bill of materials, you might be surprised how many different little bits of cryptography your system uses and how it works and what are all the different interfaces, and how complicated it can be. And really it's it's a kind of thing that on the technical side that is still very new as well. And because medical devices lead from a timeline safety support standpoint, this is one of the first industries that we're working with to really implement this post-quantum encryption. The other one is like critical infrastructure, stuff that's powering like lights, water treatment plants, buildings, that kind of stuff. The other classes of devices that you're going to install for 20 years. And so those guys today need to be planning and deploying for all of those things.
Send this link to your favorite engineer. Mohammed, nice to see you, Mr. Pistachio. Have you some comments on what you're seeing here?
I was just going to ask actually a question. Do you see a closer tie going forwards between FDA and NIST, particularly when you consider things like the FIPS programs? NIST has led the way for cryptography. It would sort of make a lot of sense for FDA to basically lean a lot more on NIST for validation of things like this. But do you
Yeah,
see that?
and that's actually exactly how it is today. The post-market guidance, they delegate all of the cryptography selection, stuff like that, because the FDA is barely getting up to speed on understanding how we do cybersecurity for devices, let alone this much deeper, even more technical topic of like what cryptography is okay, how do we pick the algorithms, what's good and what's bad. And so the guidance today already delegates that to NIST. It directs you to use the algorithms that are approved by them and to use the timelines that are approved by them. And then also, I think you've seen in the guidance, they direct you to at least reference NIST's cybersecurity frameworks and their recommendations in a whole bunch of other areas too. So
Yeah.
Can you show us a little example? I mean, just walk through really quickly in like a minute.
yeah,
I'm just like, because you did it with me and it was really cool. And
yeah.
I mean, I just thought this tool was
So let's see. So one of the things is so Cyclone DX is a standard for bill of materials, and it turns out they also have standards for cryptographic bill of materials, which is a thing in much denser, more technical fields, and it's a new up and coming thing, and so we can go pick one of the example C bombs, and so and see. So this bill of materials here says that it uses, one of the algorithms it uses is AES 128. So we can go here and look at encryption algorithms. So we'll do AES, and so AES 128 here. You'll actually see that this algorithm is allowed for quantum computing. It is a quantum resistant algorithm already. But if we go down here, so this is SHA-512 with RSA. So if we look at RSA, we'll see that RSA 1024, which we still see deployed, has been disallowed since 2014. This is disallowed by existing guidance. And then we have some recommendations about which algorithms should be replacing it. And they're either these two algorithms called MLDSA or SLHDSA. And so today, most devices are going to be deploying something like RSA 2048. And so those are going to be deprecated on 2030. And there's some recommendations here about which algorithms you should select. And then they're going to be completely disallowed for all use in 2035. And so that's quite similar for lots of these devices. And that's what you'd expect your technical teams to do, to go and audit and create one of these cryptographic bill of materials and check to see, hey, is this in compliance with even the current recommendations? And is this in compliance with the post-quantum recommendations as well?
But with just one comment on this, I mean, this is good, but your earlier point was really very pertinent, that medical devices have a very, very long lifetime, shelf life. And I would actually say that this should all be treated as an absolute minimum. So a good example with AES, I wouldn't recommend going with AES 128.
Oh, I sincerely agree. I would
go with 256 at a minimum, because for the lifetime of the device. So this is good to set a baseline, but everybody should really be striving for medical to go higher than this baseline, in my opinion.
And I sincerely agree with that. And I think for some people, security is this like thing that we have to spend money on, and we have to do it to the minimum standard possible. And for those people, hopefully we're pushing the minimum standard to safe. But I agree that everybody, if we're going to design for it to be better, the delta is not that high to design for the very best. I don't want to skip by on the minimum is good enough. I don't know that if you went to the hospital and they told you, don't worry, they designed all these devices, your ventilator, to the very minimum standards, I'm sure it's safe. That's not going to inspire confidence.
The good thing is the hardware vendors, you mentioned IoT also before, edge type devices.
Yep.
The hardware vendors are aware of this, and we've had conversations with them and pushed the envelope here. And they are starting to bring out support for native hardware support for things like elliptic curve, for instance, which wasn't there 5 years ago, but you can get processors now that can support it natively.
Yeah.
So that's always improving, which is another good factor. So.
And I agree. The hard part is one of the major pains is that RSA and ECDSA are both not quantum resistant algorithms. So we've just pushed to the point where everybody has ECDSA now, and now we got to push. now all of a sudden we have to push for this next generation of encryption all over again. But yeah, like we've talking to vendors, and they have it. It's still very new for them, so it's it's quite a complicated thing to
So
start
Mark,
rolling out.
Yeah, if
So
I
Mark,
could,
I've got a
Rick,
question.
Before you do, first,
Yeah.
Mohammed, really good to see you, and I know Jose is coming to 10X. Are you coming again this year?
I don't know. Have to ask Jose.
Yeah, I'll probably drag them along for sure.
Okay, good.
Be happy to.
Second is, Mark, years ago, I've had the group for quite a while, and years ago I asked broadly how concerned basically people were about cybersecurity, and it was just crickets. They weren't talking about it. Would you say that fear is growing to a point that adoption is following at a pace other than what you would just normally expect, normal growth? Or is it like, shit, everyone's like, okay.
Yeah, I think it's something that we've seen a lot broadly across different industries. In the medical space, it's really driven now by the FDA, like it's required, so everybody's doing it, which is really nice. And we've seen a transition from I have to do it because they say so to, oh, my investors are asking me how big is my cybersecurity team because I don't want to invest in somebody who's going to become a giant liability once they're a big enough target. And we've even seen this across other industries too, where like in the data center space, we work with lots of edge IoT devices. And now if you want a placement inside of a Google or a Facebook or Amazon or a Microsoft or a government data center, you have to comply with these voluntary standards. And that's where we've seen a ton of legacy vendors come and say, gosh, I've been making these HVAC controllers for 20 years. I need, this cybersecurity thing is new and required, and I can't be a liability to someone. So yeah, we've definitely seen, lots of strong growth in that area in concern, but primarily pushed down by large vendors who have large exposure, and other major players pushing it down. I think we've seen not as much self-selection that like I need to be secure because it's important to me as I would have hoped. So
This is pure speculation. Do you think that the new administration will have any impact on FBA cyber rules, etc., for the industry?
I truly don't know. I hope that all the agencies are
Aligned.
and separate enough that they're just going to continue their push, and they've all had a strong, steady push towards securing devices, doing better, important stuff. And I suspect we'll see that continue in the future.
John and then Rick.
Yeah, I was wondering, I mean, with the mechanical design stuff that I do, I try to make sure that I can look around corners a little bit to make sure that we don't include something in a device that is going to cause problems and cause us to do a reset midway through development or something.
Oh, yeah.
So I've got two questions. One is, are there hardware access standards? In other words, are there standards in an electromechanical device, a standard of prevention of somebody being able to just pop open the case, insert a module which would circumvent security, and and then access that way? And the other thing, and I'm actually more interested in this, is do you have accounts of where somebody got midway through development? Do you have stories of where someone got midway through development, took a good hard look at these standards, and then realized they'd wasted a ton of money, and they're halfway through and they have to go back to 10% through to design around these things, whether it be mechanical barriers or, of course, programming barriers and encryption barriers. You know,
Yeah, so I think I'll start with the first one you said. Can we have mechanical aspects of the device that help with the security? And typically, when we design security for devices, we design it such that when somebody has a device, you know, even if I make it really hard, really annoying, really frustrating, you can always take out a device, dump the data, access secure chips, all that kind of stuff. And when you properly design cybersecurity, it shouldn't matter if you have a device in your hand and you can do anything you want to it. If it does matter, then you've designed bad cybersecurity. There are some caveats to that, like patient accessible devices, you know, like the IV pumps, monitors, ventilators, all this stuff where people can walk by, change settings, touch it, do stuff. You know, you mentioned adding implants. That's quite an extreme version of that kind of the threat model. Like, can we touch a device and do something bad? And there's certainly mechanical design elements there where, and user defined elements where we want to make it easy to see and we want to make it easy to tell that that something has happened. And so that's actually where the military has quite good standards for classified for classified areas and systems about how do we design devices to make it obvious that somebody's tampered with them, and how often should we be checking that.
Yeah, that tamper evidence is specified. I mean, tamper detection.
Yeah. Oh yeah, and that's the aspect that it should have. But if somebody takes a device and compromises it to its fullest extent, it should not compromise their cybersecurity. And that's actually a big error we see in lots of designs. And that, you know, you talk about, have we seen large redesigns as a result of bad things? Most of the large redesigns as a result of failure to plan for requirements is focused around people come to us both with legacy devices that they need 510K level changes to them, as well as people who have designed new devices and got rejections from the FDA for cybersecurity reasons. And they didn't design any cybersecurity in from the beginning. And then the FDA said, well, where's your cybersecurity docs? And they're hoping to pay us, you know, a couple of $1,000s to like write some documents so they can get it approved. And they end up doing a large device redesign because it was wildly incompatible with that. You know, one good example is patchability. You have to be able to patch the software in your device if it counts as a device with software. And basically every device in our experience has been, with any microcontrollers and any software, has been falling under the cybersecurity guidance. And so that can drive large mechanical, electrical system changes just to add the patchability, let alone all the other cybersecurity stuff. That's usually what most impacts form factor.
That's interesting.
Yeah.
So what you're saying is sometimes the system upgrades required to have patchability and be able to reinforce it are so extensive that you actually have to put in different boards, different processors, different computers just to be able to handle that.
Oh yeah.
And that would back into the hardware design to design the brackets and inserts for all that stuff.
Yep. Ports,
oh
antennas, all that kind of stuff. Yep. Oh yeah. Oh yeah.
You could really get yourself in trouble if you don't know this stuff.
And there's at least one startup who failed. They ended up selling all their IP and then going away because they needed that extensive redesign. So
Mark, very quick question. Is deprecated and disallowed, is that for selling the stuff or for using the stuff?
That is for using the stuff.
And that is enforced by?
So NIST has no enforcement power at all. It's the FDA whose enforcement authority says you should not use deprecated algorithms and you shall not use disallowed algorithms.
So what I'm hearing is like from a non engineer perspective. So Mohammed and Jose and Rick, please forgive me. That the key takeaways are for people building devices now or having legacy devices now. Their investors need to be aware. They need to be aware of the changing requirements, and they need to start preparing for the changing requirements. Otherwise, they're going to find themselves in a very difficult place in just a few years with this. In the same way that, what was it, November of last year, that the FDA instituted all the new SBOM requirements in the 510(k) applications. So planning for this, having an awareness of this, what I'm trying to understand is because Mark and another group are going to be giving a presentation on this at the end of the month, how to talk to regulatory people about this topic, that to founders, investors, and regulatory people, what is the message that you're hearing? And so I'm opening that up to the non-engineers in the room. Or they can answer as well. I don't care. Is this just Greek? Is this just
I'm actually super interested in that question too, because, like we, to your point, when we tell companies all the time, just as Mark is saying, I mean, you want to start this very early in the process, because if you don't incorporate those controls, early in the architecture phase, you might get a big surprise, which is going to cost you a lot of time and money later in the game. But, in the whole regulatory and field, I'm really curious, how regulatory affairs folks are looking at this, because it feels like the kind of thing that's, I mean, I guess in regulatory, like you think of categories like biocompatibility and, sterilization and like different things where it's like it requires a very technical area of expertise. It's not just reading the regulations and understanding it. You have to understand it at a very technical level. And I'm also curious to see what on the regulatory side, a lot of the folks are seeing, for their clients and the projects that they're involved in, how companies are looking at it. Where's all our regulatory people today?
Sorry, I heard regulatory people, but I was tuning out.
Actually, I was going to add, Sean, to your statement, and I'm interested also in the answer here, but add to your statement, maybe something that's I don't know if it's different, but certainly feels different about cybersecurity, specifically in medical, is that this is not a static situation. This is a very dynamic one. And even if you think you know the answers today, they will change in a year or two. So you kind of have to take a different posture from now on. This has to be a very actively managed situation, right? Because again, even NIST themselves in a couple of years will change what's allowed, what's not allowed. This is not a fixed thing. So you from now going forwards from now on, this has to almost become like a discipline by itself that's tracked and someone has to be aware of everything happening around it all the time. Unlike sort of something where you say, I've made a decision now and that's it, I'm done. I don't have to look at it again. With cyber, you really can't take your eye off the ball anymore.
It's interesting you say that. I think that's been kind of part of the ethos of cyber for a long time, is it's constantly evolving. We're always in this cat and mouse game. And we'll do evaluations like penetration testing, and we'll tell you, we'll look at it today and it will pass, and we could evaluate it a week from now and it could fail because we've made some new discoveries, we've had some things, we've things have evolved and changed, and it's something that evolves and changes all day, every day. And it's not Yeah, it's not like biocompatibility. Like we tested it, we forgot it, it's done. It's you know, yeah, it's just like software. We have to constantly update it, check it, change it all the time.
Yeah, your system might be completely safe today, and attackers, threat actors will change their techniques. They'll improve their tools, and in a year's time, your system will no longer be okay. And
Yep,
you can't
absolutely.
just stop. But this is a new sort of paradigm that it's almost like you submit, in the past, sort of you'd submit and you'd be done because you get clearance and you're finished. But until you make some changes. But here, you don't have to make any changes, and you could be non-compliant in the
Yep.
future
Oh yeah.
without doing anything. In fact, you can't do nothing. So you have to almost like constantly be changing going forwards.
Right. So what I'm interested in is that we shift the conversation a little bit to marketing these hard topics. And we're looking at this and we're saying, so on January 8th, the quote of the day in my new journal was, "It's not the strongest of the species that survive, nor the most intelligent, but the ones most responsive to change." And that was Charles Darwin. And the if I were to pitch this to, hey, we're doing this webinar, I would talk about how, the world is changing so quickly, and cybersecurity and cryptography are no exceptions to that. So, what do device manufacturers, innovators, investors need to know to protect themselves from ugly surprises of being unprepared for the pending changes and just even meeting the requirements? And the same is true for regulatory affairs. So regulatory affairs wake up and say, this is a huge pitfall. This is a way my company could find itself in a lot of trouble with a huge re-engineering bill in front of it in the very near future if it doesn't wake up and say, wow, this is something that I need to start considering and building into my plans and make management aware of, as unfun as the topic may be,
Unfun.
or as technical as the topic may be. How do I impress upon them the urgency? And that's why, the FDA is going with the NIST requirements, and they're going to be required. So when you tell regulatory people it's a requirement, it is now a requirement. The FDA now requires this, and the FDA is going to be requiring this in the very near future. So, taking that message to market and then saying to the marketplace, how do we bring this story to life? And that's something that we all struggle with, is how to take complex information and communicate it to the people that need to know at a level that they're able to understand it, appreciate it, and take action. No? Sorry.
Sean,
Yeah,
I think from my perspective, I'm just waiting for more information that connects dots and makes sense. Right now, we have this engineering algorithm speak across the entire world. I'm not talking about this environment. I'm talking about in the entire world. And all we see is warning signs, lots of blaring warning signs, right? And we've seen like airlines shut down, banks shut down, so on and so forth. So we know that there's a problem there, right? But we don't know how to get there. And we need somebody to connect the dots for us to demonstrate, A, this is how much it's going to cost, like quality management has done. quality management, there are protocols and procedures in place, and there's somebody responsible for it. We have to hire somebody new to run the show, right? So we have to have the funding. And from startups, that's not entirely possible. Um, uh, we need somebody that is going to translate for us. These are the extreme ramifications, and here's the percentage of probability that you are risking. If it's a 99% risk, people will do it. But right now, it seems like the most, it seems like a 1 to 5% risk. So do we dedicate 100,000 to something that we don't have? And when the risk is so low, when we're just trying to get to market and stay on market.
The
And
risk is
until-
100% though. Like that's the thing. I think that's how you have to tell companies now is if your medical device has software, that's pretty much the decision tree. If your medical device has software, you have to submit a cybersecurity package when you submit your 510(k) through the E-Star system. And so it's 100% risk that if you don't do this, you're not going to get cleared because you're not even going to get past,
Risk isn't the
step
right
one.
word, though. If you
What's that?
say it's risk, sounds like it's an either or. You could just say, hey, it's mandatory. You're not getting
Exactly,
cleared.
exactly.
That's not
I mean,
a
that's what
risk.
it means for the risk to be 100% from a regulatory and business standpoint. Like you just won't get your device to market if you don't do the cybersecurity piece of it. Now, the actual risk of like, let's say that your company eventually gets hacked, gets caught in a ransomware attack or something like that. Obviously, that's very different. But in fact, even there, it's interesting. In cybersecurity, there's a paradigm shift in how you think about risk
You
because,
said paradigm shift. Shut him off.
oh, come
Alyssa,
Put
I
him
think
on
it's
mute.
you talked about the
Paradigm.
risk, and one of those things I think is the cybersecurity is right sized, right? The not everybody's making a really complicated, expensive device, and lots of people will try to cybersecurity everything for a really expensive thing, and when in reality, if you're making a simple device, the simple software, it really doesn't need expensive cybersecurity. It can be a much, much shorter, easier, faster approach.
That's the thing that companies need to understand. We don't have a cyber, I mean, we just need cybersecurity protection, right? And we have insurance for that and all of that good stuff. But and our device doesn't require that, but eventually we want it to. So we're looking at channels and pathways, and it would probably be a simplistic one. And so that's the message that needs to be conveyed to anybody developing is there's a myriad to choose from, and here is where your device is placed. And that might be a really good presentation to do. Like, here's an example of a device. This is how much it costs. This is how much it costs to maintain it. And to the extreme, so people can see that it's not so far out of reach and out of touch.
Yeah, I really like that because one of the things is when we help people design their devices is everybody wants this like phone app, internet connected, whiz bang, Bluetooth, everything. And we'll often walk them back from that towards something that's not the best in the world. Because, it's like, can you support paying real cybersecurity professionals on staff all the time, every year for 10 years? If the answer is no, then you really can't afford to have, a web connected, internet connected thing. And if that's only, helping you, with a whiz bang thing, but not really helping your customers, you can't afford it and you don't need it. So yeah, I really like that thought process and communicating that
I would look
message.
at it maybe slightly differently and say that security is really part of your system, and you could change how you're approaching your system to make you less vulnerable. So it isn't all about, it isn't just about I go do what I want to do and then I try to secure it. Sometimes just looking at what you're trying to do and coming up with a different way of doing it might make it more secure. You may end up saving money, not actually spending money. So you have to sort of take a holistic view. But I think, Alyssa, the point you're trying to make is that there isn't this clear picture to someone developing a device of what is it that they need to secure and how much does it cost to secure it. And I think it's Is that correct? Because I
Yeah.
think
I
because I think
think
where Jose was
if there
trying to go.
if there was just like a cheat sheet, here's how to save money on your cybersecurity. You know, like that would be a great meeting. You know you need it. You know you're gonna need it. Here's the cheat codes on pearls, tips, and tricks of how to save money as you're working through your build out.
I have a vision of a locomotive at about 25 feet.
Yeah, because
With
I think
ahead.
though, but I think there are two different domains to consider here. There's the domain of FDA and what FDA is expecting, and what you need to do for that. And I'm just going to put that to one side and say that's one piece. And then there's the domain of the product itself and the company and the market and all of that side. And there's that as well because I think one of the things that, for instance, isn't mentioned a lot is FDA may be looking at this from a security perspective in terms of patient safety, and that's their focus, and that's the right thing. But companies need to consider that threats can cause massive distress to a company, independently of whether it harms a patient or not. So security has to be looked at from both facets. You can't just look at it purely from what does FDA need. You know, it may be that what you need for FDA is minimal, but the harm to you as a company of not having security could be massive. And it could be the other way around too.
And one of the easiest areas where we put where we communicate about what's the P&L of your cybersecurity is with disposables and accessories, which is an area we do quite a lot of work in. If you make an accessory or a disposable for your device, and you're making 90% margin on your disposable, the FDA doesn't really care how secure your ecosystem is. You can have a reprocessor come in and reprocess your single-use disposable and sell it again, and they're selling for half the price. They're only making 40% margin, but now they're cutting out a big chunk of your business. And all of a sudden, the cost of having really good product security, really good ecosystem security, or revenue protection is much higher. It's very important. And if you're gonna lose $100 a device on $1,000 disposable, because of the reprocessors, well, now you can afford to put in a $4 security chip with hundreds of thousands of $1 million of NRE to protect your $100 million disposable revenue. Because lots of companies selling disposables with these ecosystem approaches, that's where all their profit is coming from. It's coming from the disposable sales, and all of a sudden you're going to gut yourself if that cybersecurity, if that revenue protection isn't top of mind for you.
Interesting.
Unfortunately, most of the time it's not that clear cut. But
yeah, and there's complexity too. Don't mute me again, Joe. Flick you off again.
Don't
There's
use the
complexity too,
expression.
because sometimes there's business decisions there where, for example, like adding cloud connectivity maybe does create additional challenges on cybersecurity. But even on the cybersecurity side, there's requirements that if there's a vulnerability that's found and it's critical, that it be updated, patched in a quick fashion. Well, if you have a cloud connected device that can do an over-the-air software update, that's a means by which to fairly inexpensively update all your devices in the field. If you don't, now you got to figure out another means, like maybe it's a recall, or maybe it's like, a technician going out and updating things. So it is, it's a overall system from a business standpoint. It does get complicated, estimating all the overall costs and trade-offs.
But I do think there are, some questions that you could be asking, like, do we need this? What's the cost? Or, hey, I need cloud connectivity. How much does cloud connectivity cost from a cyber perspective?
I think to address Alyssa's initial comments, I think you could pretty easily come up with I'm thinking of it now, a sort of a cheat sheet on at least where to find the costs and what are the trade-offs. And maybe you just start with that sort of as a matrix and say, this is how you should approach it. Now, someone who is not knowledgeable may not be able to instantly get all the answers, but at least they know where to go look for what the questions are and where to go ask. Because it is multifaceted, and you do have to look at this from a lot of different, and it's constantly changing. So it's a difficult one to sort of pin down with a single, like, here's the answer. Because but I could see a path to slowly improve the conversation. So
Michelle?
Yes, thank you for the wonderful discussion, but I just have really simple questions. So like our devices is already in the market, both in US and well, actually worldwide for the last 30 years, and they're very simple. We call them firmwares. So they really just do the IOs and control the unit. Would this be forced to have to be in compliance with this new guidance as well, or it will be sort of somewhat exempt?
Well, a device that really is very simple and doesn't do very much should be exempt, especially if it doesn't have any access ports or any communication or anything like that. And that's a strategy that we work with people to define their devices to go under that line. The hard part is the FDA right now is very conservative with their determinations about what is and isn't cybersecurity exempt. And so if you want to have software that's cybersecurity exempt, you really have to try hard to angle that way. And it's definitely worth a pre-submission call with the FDA to say, hey, we want to do this. Here's why. Here's what we want to do. How do we do that? We haven't seen it be terribly effective for devices to try to fly under that line, but it is possible.
Well, we have 3 product lines. One of them is sort of kind of legacy, it's been in the market for 30 some years. And we have 2 different devices just clear 510K maybe within the last 5 years, even though we call them firmware, but we still have to submit the software VMV according to the ISO standards, because that device was sent for CE mark for MD. Well, it was MDD class 2A. So it's still, I mean, it's not terribly complicated being an IT professional for 28 years before moving to medical device. I mean, software is quite straightforward, just IO interrupts, but we still were asked to do the software VMV. So would those 2 devices need to have those new guidance to be in compliance with those 2 new guidances?
Yeah, and the answer is maybe. And I'd love to. Yeah, it maybe, and it can be hard to fly under the guidance. It definitely takes some work. So yeah, I'd have to see more and understand more.
Mark, where are you located?
I'm in Tucson, Arizona.
Oh, right, he did say that. Well, it's not too far to get to Newport Beach. Maybe you can collaborate with Mohammed and Jose and be part of our conversation in California in May, if that's an option for you.
Yeah, well, I'd love to. I'm not familiar with you guys doing. I'd love to learn more. So it sounds like fun.
I'm getting a lot of comments here in the chat about presentation today. So thank you very much.
Thank you. Thank you.
This was very informative, and it was far more informative to those who understood what the fuck you were talking about than it was for me. But I can tell by the faces that you educated people who know what you're talking about. So that's good. That's my
I'm so glad. Yeah, I'm so glad to meet all you guys. I had a great time chatting to all you guys.
Luke?
I still have a question. You say that the cryptographic algorithms, they are depreciated after some time because then they are easier to crack. What about the dangers of harvesting now the data and decrypt them later? Should we worry about the data we produce now?
Yeah, oh yeah, and that's the main reason why NIST has set the deprecation dates for the quantum so early, is not because we think we're going to have quantum computers in 5 years that can actually perform these attacks, but because quantum computers in 10 or 15 years that can do these attacks, we're worried about that attack vector, the harvest now, decrypt later, where we know we can do it in the future. So we're going to gather everything we can and decrypt everything when we get there. And that's especially relevant for PII, health information storage systems, all that kind of stuff. So
And what Mohammed said that the requirements can change over time. Should we design now with a lot of headroom on bandwidth and computing power?
Yeah, I think that that's a device-to-device decision to make about how much swap, how much space, weight, power, extra space that you have designed into your device. If you're What I expect to happen is that these first generation post-quantum algorithms are actually going to be the most complicated, the most costly from a computing power space perspective. And just like we saw with other encryption algorithms over the past 25 years, where we actually got better at making faster, smaller algorithms that were just as secure, I expect that to happen with the post-quantum encryption. So I don't know if I would include a huge amount of extra space for that beyond what's required for post-quantum, but certainly I would be budgeting some for cryptography and all of the other cybersecurity changes that are going to happen, as attacks get better, defenders get better, all those kinds of things.
Thank you very much.
Amir, you're new to me, or I don't know that you've joined us before. Where are you located and what do you do?
Yeah, hi everyone. My name is Amir. I am a dentist, but I used to be a biomedical engineer beforehand. And I live in DC. So I am a practicing dentist, but I also started kind of a startup a few years back. During residency, I saw a lot of shit, and so I figured we need to find solutions. So I started inventing a lot of things for the world of hospital dentistry. And someone led me to your group, and so I figured I'd say hello.
Hello. Well, we do this every week. You're very welcome here. Luke is responsible for next week's guest. Can you tell us a little bit what we can expect, Luke?
Get me off mute. Benjamin represents a company that designs a chip especially for physiological measurements. So it's I think it would be great for Jose and others for wearables, because the chip is running around all the great chips from TI and analog devices. And he probably also tells something about how it is to run a startup like that. He's not the CEO, he's the how do you call it?
Chief Technology Officer?
No, he's not the technology, he's more in sales and marketing.
Oh, okay.
But he is an engineer though.
Okay. At heart, yes.
At heart. And he's a nice guy.
I was going to conclude our call here, but Frank is someone who doesn't join us often. So Frank, I unmuted you and hoping you'll come on camera because you had a question for Mark. He may be having some technical difficulties. In the meanwhile, he wrote, oh, here he is. Frank, we can't hear you, but we can see you.
Oh, that works. Yes. So I had a question related
Where are
to.
you? Where are you located? What do you do? Tell the folks.
I'm in Pasadena, California, south of the fires. I'm working on an instrument that's using an infrared camera to do current pulmonary monitoring, do all vital signs, and looking at implementing this on a cell phone and potentially small laptops. And my question relates to if you were implementing this on a cell phone, how would you implement these security measures that you're suggesting?
Yeah, so I think a cell phone, it depends how important your cell phone is to your product. If it's like a user uses their own cell phone as an accessory, there are some well-defined ways to pass data securely from a device up to a cell phone, up to a a server and out. And if a cell phone is part of your device, then that makes it a lot more complicated, because a cell phone is quite a complicated piece of technology with a very large surface area for attack. And so it can be, one of the hardest things to secure and to prove that's secure if you kind of adopt it into your device. So we would always recommend to people, when you're designing devices, we'll often design custom versions of Android that have just the minimum set of things you need to make it as easy as to secure, or to delegate that, make the device bring your own from the user perspective, and try to make it, the whole system, secure no matter what, even if the user's device is compromised. It's, yeah, adding a cell phone into your device can be quite a large scope expansion, but it can be quite useful for like quick prototyping, demos, that kind of stuff, on your way to a full device, that kind of thing as well.
Well, the cell phone is using the processing power of the cell phone. We use an infrared camera and the audio from the phone to be doing all this work. I mean, we're identifying parts of the body that we're looking at, and doing the thermal analysis, of an artery, to be looking at the thermal facsimile of what the blood pulse wave shape is, and using that to predict blood pressure. So it's and then we're just using the communication facilities of the phone to be passing this information. So it's an integral part of it, whether it was a cell phone or a computing system. So I think you're saying if you were using a cell phone, it'd make life a lot more complicated.
It definitely can, yeah.
Would you have to make the phone dedicated and restricted from all the other functions that the phone would normally do? Would that be a way around it?
Well, potentially. And one of the other things that you can do is, instead of making this a device, it's a SAMD. It's an app for a phone, and that might be more for some types of devices. That might be a better fit, where you're making an accessory, and you also have a SAMD that gets installed on the user's phone, instead of the phone is part of your device. Because that might be closer to essentially what you're doing with that, where it's kind of like the USB connected ultrasound devices, things like that.
Yeah, okay. Well, I'm going to need your help.
Yes, on that note, Mark, why don't you go ahead and put your contact information in?
Yeah.
And for Frank and Amir, I put a link to what 10X is. If you're completely unfamiliar, this will be our 15th annual get-together. You'll see that it's more of a coffee klatch among friends, that we talk about relevant things while enjoying camaraderie and ice cream.
Yeah,
Frank,
I like your walk sign in the background there.
Yes.
Frank, I posted also in chat because I didn't want to talk over Mark, but yeah, there are techniques where you can, for instance, if the phone is just a transport, if all you want to do is move data through it, there's ways of still keeping it in the system and securing it. And even if, as Mark said, even if it needs to display some information, there are also techniques we can use to lower the threats, but still keep it secure. So there's lots of approaches. Just have to look at how your system is structured.
There's a lot of expertise in this group for you, Frank. So perhaps we'll see you again.
Very good. I'll be back.
All right. Well,
If you ever want to put it in, if you ever want to put your sensor in the mouth, let me know.
I'm sorry?
If you ever want to put that sensor in the mouth, let me know.
Okay.
Mohammed, now back on screen. If you want to reinforce what you were saying to Frank, it's easier when we see you.
Oh, I'm sorry. Yeah, no, as I said, I actually put it in the chat, but basically if you're using a phone we use this all the time. Phones are very common devices to use as transports, where medical data can go through a phone to a cloud, as an example. It doesn't mean the phone can be very insecure. In fact, phones typically are very insecure, but there are ways to securely move medical data through a phone. You can basically imagine tunneling through a phone. So the phone isn't really seeing the data. The data just passes through it. So that's just a technique.
And for context, for those who don't know you and Jose, when you say we use it all the time, who is we and how are you using it?
Sorry. we as in bolt type in medical device products that we create, and the projects we've worked on. So yeah, does that help?
What's our phrase, Jose? Wireless connected medical devices?
Yeah,
Right.
I mean, largely we do like apps embedded in cloud. So the types of systems that go from embedded software all the way through the cloud, that's kind of our bread and butter. And then
Why don't you go ahead and put your contact information in there as well, and I'll pause just a moment because once the webinar ends, all that nice chat stuff goes. And you call
So
me
while
later and
you're
say, oh, I
pausing,
didn't
I'm
get their
gonna
email
start
address.
interrupting. How's that sound? We are launching this weekend. I swear to God, I'm getting caught up on the entire launch of 10X this weekend. And how you can when you decide. So first of all, if you're uncertain about attending, please contact me, Sean at veer2b2b.com, and have a call, and let's talk about what you want to get out of it, and what would make it valuable to you, because we are restructuring the event to be a lot more interactive with shorter presentations, more workshops, and the goal is to have everyone in the room meet everyone in the room, you know, and that means moving them through a series of discussions. If any of you are interested in leading a discussion group, you know, you don't need to be a speaker, you can be a workshop leader. Please reach out to me. We want to provide as many opportunities for the loyal MDG participants, and returning participants, as well as the new participants. So it's going to be a lot more involved, a lot more hands-on, a lot more interactive. As Joe and I have discussed, you know, as a marketer, as a presenter, as a trade show sponsor, it's oftentimes a disheartening thing to go to trade shows. And what has impressed me about the 10X group and going last year is this opportunity to approach it very, very differently. So what we need to do is we need to get some more startups, some more OEMs, some more investors in the room, so that everybody gets a 360-degree exposure to the medtech ecosystem, if Joe will excuse that expression.
I'll let that one go. I'll say that I've always felt that everyone in the room has something to contribute, which is why I've always tried to get as many people in front of the room, typically in a fast round, which is a 5-minute interview with me, which we record and you can use on your website. Yeah, you don't have to be the CEO of something and, you know, a known thought leader to know something that we don't know. So, you know, even somebody like Andre could teach us something, but he categorically refuses to come because of this anniversary of his every year, and that his wife doesn't want to come, which I think is bullshit, just to throw it out there.
Can I just have a quick question?
Is it for Andre?
No, for myself.
Fuck that guy, right? Go on.
I didn't say that, you say that.
I did.
So I never been there. So do we have to book our own hotel, or does that include it?
No, it's not included, but I have a link, which I'll put here for you. I typically.
Yeah, that's what I thought. I don't want to go out there and have no place. I don't want to be homeless.
You'll have a place. The Hyatt is already, that link is already set up for our group rate. It'll be cheaper than anything you'll find on the site. We have a block of rooms.
And it's super easy to book. I was worried about that too. And Joe made it really easy. You just click and then you pick the room that you want. And then the discount is applied.
Thank you.
You're coming back this year, Patricia?
I'm gonna try to. I gotta see where I am.
Well,
like physically.
What my policy is that if you're not coming, you don't need to pay. So a lot of people in industry have these, cancellation policies, like either you can't, or, you get 50%. I don't need your money if you're not coming. I don't need to pay for you if you're not coming. So I give you everything back. If the week before something happens, just let me know. I'm not a big enterprise. I'm just two guys, me and Sean, which I'm very grateful for.
Yes, thank you.
Ladies
I
and gentlemen,
pass.
thank you for celebrating Lucas's birthday with me. You are again welcome to pay at a discount today. And we will see you same back time next week for Joe Hage and Sean Smith Enterprises. This has been Joe Hage and Sean Smith with special guest Mark Omo, who may join us in May. Thank you, and we'll see you next week. Bye, everyone.
Bye.
Thank you all.